There's two things that I'm really excited about that I'd like to talk about briefly. One is yesterday, I sat in the audience and watched us change Dogma. We have now heard the recommendations for the 2017 revision of the McDonald criteria. What I'm saying is we've redefined how we diagnose MS. And so, as you look at the diagnostic criteria going back from the 80s forward, we've become faster and faster and faster. And moving from 2010 to 2017 criteria, we've done that yet again. By reintroducing the use of spinal fluid early on with clinically isolated syndrome, we can confirm an MS diagnosis much faster. This is very important because the quicker we can make the diagnosis, the faster we can initiate disease-modifying therapy. Data is outstanding, proving the point that the earlier the better. And so that was very exciting to participate in that audience. I'm also very excited at some of the long-term follow-up data. When you do a 2-year clinical trial, it's a very short epoch. MS is measured by decades, and the person's going to live with the condition for 30, 40 years. As such, a 2-year investigation may be fully inadequate to really have a meaningful conversation in the real world about what do we expect. Some of the posters that I participated on looked at alemtuzumab and the 7-year long-term follow-up data, and it's amazing. Really, in a nutshell, what we're seeing is going out 7 years, even though over half of patients never got retreated, there's a durable effect. We're seeing a maintenance of a very, very low annualized relapse rate. Confirmed disability progression diminishes and stays remarkably low. MRI measures, including atrophy and inflammatory measures, remain amazingly low despite retreatment. Most importantly, the side effect profiles aren't changing. So having that information in hand, I can now go back to Columbus, Ohio, and treat people and share with them our expectations now going out 7 years. And that's really meaningful.